Okay, welcome to anatomy lecture number 8. Today we are going to talk about the hip flexors, the adductors and the quads. So focusing in on those muscles in the around the hip joint and starting to move down towards the knee joint. As always, the content in this lecture is building upon the previous 7 lectures, so please make sure you're familiar with all that content before you move on to this content. With that in mind, let's have a little recap. Let's go back to some stuff we covered in lecture number 1 and talk about the planes of the body. The planes of the body divide the body up so we can describe different portions of the body. There are 3 main planes. The first of these 3 main planes is the sagittal plane. That divides the body into left and right sides, and they do not have to be equal in size. However, if we want equal left and right sides, we can describe the mid-sagittal plane, which is sometimes referred to as the median plane. So a sagittal plane divides the body into left and right sides. You can see a mid-sagittal plane in the diagram there, where the plane is passing through the middle of the person's body, dividing it into equal left and right sides. But equally, that plane could shift and could pass through the shoulder, for example. So it is still dividing the body into left and right sides, just not equal left and right sides. We also have our second of the 3 main planes, which is the frontal or the coronal plane. Same name, 2 names for the same plane. It divides the body into front and back, or more specifically, anterior and posterior portions. The frontal or coronal plane runs perpendicular to the sagittal plane, so it's at a right angle to the sagittal plane, and it allows us to describe things that are either anterior or posterior, to the front or to the back. Finally, then, we've got the third of our 3 main planes, which is the horizontal or transverse plane. Again, 2 names for the same thing, and this divides the body into upper and lower portions, or again, more specifically, superior and inferior portions. This runs parallel to the ground. So there are 3 main planes: the sagittal plane, the frontal or coronal plane, and finally the horizontal or transverse plane, dividing the body into left and right, front and back, upper and lower. Okay, moving on to some new content for today. We said we are going to look at the hip flexors, the adductors and the quadriceps. So each of those 3 are muscle groups. So within the hip flexors, we've got a number of individual muscles. Within the adductors, a number of individual muscles. And within the quadriceps, we've got a number of individual muscles. I'm going to go through each of the muscles one by one. But really what I want you to be familiar with is the group of muscles, generally what that group of muscles do, and where the muscles are located. With the quadriceps, it's probably good to know a little bit more detail about them, so you might try to remember a bit more about the individual muscles in the quadriceps muscle group. So we'll get started. I'm going to switch over to my model. There we go. Sorry, hit the wrong screen. And we will crack on. So we said we'll start by looking at the hip flexors. So the hip flexors, again, are a group of muscles, and unsurprisingly, they are mostly involved in flexing the hip. So that is bringing the knee up in front of the hip here. So if we raise this knee up, we are decreasing the angle at the hip joint there. And it is the job of the hip flexor muscle group to do that. So first of the hip flexor muscles I want to look at is a large and deep muscle called the psoas major. So you see there we have gone from no muscles, we're adding in the deepest muscle layer, and then the next most superficial muscle layer, and we see there's 2 muscles of interest that are after popping up in those layers there. The first is this guy here, which is called the psoas major muscle. The psoas major originates on your vertebrae, so L1 through to L5, all of your lumbar vertebrae. So we can see there that it inserts it originates, I beg your pardon, originates on those 5 vertebrae there. 1, 2, 3, 4, and 5. The belly of the muscle passes down through the lower part of your abdomen, and it crosses over the hip joint, and then the muscle inserts, the psoas major muscle inserts onto your femur. So we see, I'll raise that up there, we see we've got the insertion here onto the femur. So this muscle originates on the spine, inserts onto the femur. As the muscle contracts, the insertion will move towards the origin, so it will pull the femur upwards, flexing the hip. So as this muscle contracts, the femur will be pulled upwards. Remember, as a muscle contracts, it exerts a force by pulling on the bone, and it'll bring that femur up in front, or bring your knee up in front of your hip, flexing the hip joints. Okay, that is our psoas major muscle. The next muscle we want to look at is very, very similar. It is just beside it here. It is called the iliacus muscle. So the iliacus muscle originates this time on your hip. So it originates on the medial surface of the hip. So that's the surface of the hip that is towards the midline of the body. Again, the belly of the muscle crosses over the hip joint, and very, very similar to our psoas major, the iliacus muscle inserts onto your femur there. So the action, again, this action of this muscle is to flex the thigh at the hip. Now, both of those muscles that we've just mentioned, the hip, the iliacus and the psoas major, we focused in on their function as a hip flexor, so flexing the hip joint there, raising that knee, raising that femur up in front. But those muscles are also involved in trunk flexion as well. So if we keep our femurs fixed and we're looking to flex the trunk, so to do a sit-up type movement, these muscles will also be involved to a certain degree in that trunk flexion as well. However, today we are referring to them as a part of the hip flexor group. So there are two of the deep muscles there. We'll highlight the two of them, the psoas major and the iliacus muscle. Okay, the next muscle we want to look at, we've got to layer up a few more. I'm just going to exit those two there. Layer up a few more muscles. The next one I want to look at here is this muscle here called the sartorius muscle. It's a band of muscle that originates on the top of the hip. Specifically, it originates on the anterior superior iliac spine. That is this bony point at the front of your hip here. If you were to ask someone to put their hands on their hips at the front, they will instinctively point to this bony bit, the bony bit of your hip that sticks out at the front. That is known as your ASIS, your anterior superior iliac spine. ASIS, anterior superior iliac spine. It should be no surprise then to note that back here we have another one that you can also feel. If you put your hands to the back of your hips there and feel another bony prominence around the back, you've got your posterior superior iliac spine. So the anterior superior iliac spine is here. Back here we've got the posterior superior iliac spine. So the origin of the sartorius muscle is the ASIS. Then it's a long kind of strap of a muscle that runs across the hip joint. It runs down the anterior surface of the thigh, crosses medially, and then it runs down the inside of the knee joint, crosses the knee joint as well, and inserts onto the tibia. So it's this big muscle here running from the anterior superior iliac spine all the way across the hip joint, the full length of your femur, crosses your knee joint and inserts onto your tibia. So this muscle here crosses two joints, so therefore it's going to be involved in multiple actions. We are interested in it as part of the movement at the hip joints. So this job. This muscle flexes, adducts, and laterally rotates the thigh at the hip joint. So it's involved in hip flexion as part of the hip flexors, but it also is involved in abduction. So that is movement of the thigh away from the midline of the body, and it's also involved in lateral rotation of the thigh at the hip joint. So if you were to turn your foot out away from the midline of your body, your sartorius muscle is helping to do that external or lateral rotation there. Because this crosses the knee joint, it is also involved in movement at the knee joint. So this flexes the knee joint, the sartorius. So flexion of the knee joint is when you decrease the angle of the joint at the knee. So bringing your tibia up behind here. That is another one of the functions of the sartorius muscle there. Okay. The next one I want to look at is another muscle called the TFL, or the tensor fascia latae. Okay, that muscle here originates up on the anterior superior iliac spine as well. So it originates in the similar area as the sartorius that we just mentioned. But it runs a little bit up on the back of the iliac crest here as well. So on this bony prominence at the front, and then up along the crest of the iliac crest there. Then this muscle inserts onto the tibia. Now we can't really see the insertion on the tibia at the moment, because what we have is a long band of connective tissue that joins this muscle, the TFL, the tensor fascia latae muscle, joins this iliotibial tract. Okay, that is this big band of connective tissue that attaches the iliac crest up at the top here to the tibia down here. So it inserts, we can see the front of the knee, inserts onto the front of the knee there, and it's removed from it here, but the TFL muscle sits into this space here. So if we look at the two of them together, we have the TFL muscle and the iliotibial tract, the band of connective tissue that work in unison together. So this muscle starts up on your hip, on your iliac crest and your ASIS. Then the muscle ends. The muscle is quite short. The belly of the muscle is only up here around about the top of your around about the size of your glutes there. And then this band of connective tissue actually inserts that muscle onto the tibia at the knee joints. So this muscle again is involved in flexion at the thigh, flexion of the hip at the thigh. And it's also involved in medial rotation and abduction of the thigh at the hip joints. Okay, so it generates movement at the hip. This one is interesting because people will also often use foam rollers, self-myofascial release. So foam roller massage along the outer edge of their thigh here. And most of the time when they're running up the outside of the edge of their thigh here, what they're actually rolling is this band of connective tissue here. And they might be targeting that area to try and alleviate some pain. What can happen here is if you've got a tightness in your TFL muscle up here, the muscle will contract and be tight. It'll pull on this connective tissue, and you can actually experience the pain much lower down, closer to your knee here. So if you're using a foam roller or self-myofascial release, you would be better off targeting this area of muscle here to try and get some release the tension on this band of connective tissue to alleviate the pain that you might be experiencing lower down. But blindly foam rolling up and down on this band of connective tissue here is not going to be, may not be as effective as specifically targeting the muscle that's located up here. That's a little digression there. So that is the TFL muscle, the tensor fascia latae, and they're the primary muscles that we want to refer to as part of the hip flexor muscle group. So we have the TFL, the sartorius, and then if we strip back there, we have our psoas major. Why did it disappear? Why are they disappearing on me? Okay, that's interesting. I didn't know I could make bones disappear like that. I am not sure how I did it. Show hidden. Okay, so we've got all the bones back in there. So we have our iliacus muscle, our psoas major muscle, and then if we come back up to the surface, we have our sartorius muscle and our TFL muscle. So they are the part of the hip flexor muscle group. So when we're talking about the hip flexors, we are talking about those muscles there. Now, there's one extra muscle in this area that I want to, that is involved in hip flexion that I want to refer to. So I'll exit that grouping there. So what we're going to do now is jump to talk about the quadriceps, and one of the main muscles of the quadriceps is the rectus femoris. Okay, that is this large muscle on the anterior surface of your femur, on your thigh here. If we isolate and have a look at that, we see that your rectus femoris muscle originates on the anterior inferior iliac spine. So that is this bony landmark here. So it's the anterior towards the front, inferior, lower iliac spine. So we can see quite clearly there the origin of our rectus femoris muscle, joined by this tendon. We've got the belly of the muscle, which sits on the anterior surface of the thigh, and it runs down to the knee joint, and it crosses over the knee joint and inserts onto the tibia below the knee. Now I'll show you that insertion in a little bit more detail in a moment. But before we move on to that, the quadriceps muscle here, the rectus femoris muscle, which is part of your quadriceps muscle group, it crosses the hip and it crosses the knee. So this muscle here is also involved in hip flexion, excuse me, but its primary job is to extend the knee. So the rectus femoris on its own is one of the quadricep muscles. It's also involved in hip flexion with all of the hip flexor muscles that we just mentioned. So we've got the rectus femoris can be considered a hip flexor as well, because that is one of the jobs. It flexes the thigh at the hip joint. Okay, so let's move on and look at the rest of the quadriceps. So we said we've got this rectus femoris, that is the main muscle of the quadriceps there. It is the one that sits most superficial. It runs down the center, more or less on the center of your thigh there. Unsurprisingly, in the quadriceps muscle group, the name implies there are 4 of them. So the rectus femoris is one of the quadriceps. We have got 3 others that sit underneath the rectus femoris. They've all got logical naming, but they are the name might sound unusual, but it's fairly logical. So we've got a muscle here called the vastus lateralis. So this is the vastus lateralis. It is lateral towards the outside of the body there when compared to the rectus femoris or the other 2 muscles that we're going to look at. So the vastus lateralis originates on the femur. So you see here is the head of the femur, which forms the hip joint. The vastus lateralis originates on the femur below the hip joint. It does not cross the hip joint. It is not involved in movement at the hip joint. The vastus lateralis muscle then, the belly of it runs the length of the muscle, and again it joins in here with the other quadriceps muscles which cross over the knee joint and insert onto the tibia. We will look at that insertion in more detail in a moment. So we have the vastus lateralis. It should be no surprise then that we've got another one called the vastus medialis. The vastus medialis is the more medial muscle of these 3 that we're looking at here. So again, if we isolate that, we see that it also originates on the femur below the hip joint. It is not involved in movement at the hip joint. The vastus medialis muscle runs the length of the femur, but the bulk of the muscle is slightly lower down. It's the muscle that gives your quadriceps that kind of teardrop shape on the inside. So this medial towards the midline muscle here, your vastus medialis. And then finally we have, I'm just going to take off a layer, we have this muscle here, the vastus intermedius. So it lies in between the other two. So we've got our vastus lateralis, our vastus medialis, and our vastus intermedius muscle, which lies in between the two of them. And again, like the other two vastus muscles, this originates on the femur below the hip joint. It is not involved in movement at the hip. It runs the length of the femur, and then it joins in with the other quadriceps muscles, which cross the knee joint and insert onto the tibia. So let's have a look at that now in a little bit more detail. If we put we'll highlight the three of them. So we've got our vastus intermedius highlighted, plus our vastus lateralis, plus our vastus medius, and then we'll put the rectus femoris back on top. And if we zoom in here, we've got all four quadriceps muscles selected there. And if we zoom in, we see that they all join together here at this point. So they converge together, and we've got this tendon here, which has its own name. But all of these four muscles converge on this one spot, and all their tendons join together to form this tendon of the quadriceps muscle, which is at the top here, the specific name for the top portion of the tendon. And then below that, we've got the patellar ligaments. So the tendon of the quadriceps joins those muscles onto the patella. And then below the patella, we've got the patellar ligament, which joins the patella to the tibia. Okay, so we can consider this kind of one continuous structure here from the muscles through the tendon which joins them to the patella. The patella is the sesamoid bone that's located in that tendon, and then we've got the ligament which joins the tendon to the bone here. So we've got our quadriceps muscles all originating either on the femur or up on the hip there, running down the length of the femur, crossing the knee joint and inserting onto the anterior surface of the tibia here. Okay, so if we look at that in isolation there, we've got this patellar ligament, and it inserts onto the front of the tibia here, the proximal part of the tibia, to help create movement. So all of those quadriceps muscles together are all involved in extension of the knee. As they contract, they will pull via this tendon and this ligament on the bone of the lower leg, on the tibia here, and extend it from a flexed position. So if the leg is flexed, the knee is flexed, and we want to straighten it back out, our quadriceps will perform that action. So exercises that are going to target those muscles are going to be things like a squat and any squat variation, a leg press, or a lunge. Any of those movements that target extension of the knee are going to work those quadricep muscles. So they're the four quadricep muscles and how they join onto the lower leg. Okay, the last thing we want to look at then in this lecture is the adductor muscle group. So the adductor muscle group is, again, a group of muscles. I'm not going to get too bogged down going through the individual muscles. I just want to show them to you. But what we have are muscles that are involved in adduction. So movement of the femur at the hip, drawing the femur towards the midline of the body, keeping that knee in position here, keeping the femur where it should be. So we have a couple of muscles here. We have the pectineus muscle. We have the adductor longus muscle. We have the gracialis muscle, and we have this fella here, the adductor brevis muscle. So those 4 muscles there are adductors that are visible from the anterior view. We can see those there, and there's one other big adductor muscle that I want to show you. We have to spin around the back here to get a look at it. Now even here it's a little bit tricky to see it, but if I highlight this guy here, we've got the adductor magnus muscle. If I strip back our hamstrings there, take away our hamstrings, our adductor magnus is this big muscle here. So you see, compared to the ones that we see from the front, that is a large muscle there. So we've got 5 muscles now in this group. We have got the adductor magnus, which is located around the back. We can see here it originates on the posterior surface of the femur, and it inserts onto the it originates. These originate on the pelvis, and this inserts onto the posterior surface of the femur there. If we spin around and look at the front, we've got again. If I isolate them all, we've got this band, all these muscles here, originating up on the hip, inserting onto the femur and just below the knee, and they are all involved in pulling that knee in, adduction of the knee. So we've got 5 muscles: the pectineus, the adductor longus, the adductor brevis, the gracialis, and the adductor magnus muscle. All of those are part of your adductor muscle group. So again, it's nice to know that you have the adductor muscle group and the hip flexor group. Need to know that you have an adductor muscle group and a hip flexor muscle group and what they do. You need to know that there are individual muscles in it. It is nice to know the details of the specific muscles that are in that group. The more knowledge you have here, the better. Your hip flexors and your adductors, groups of muscles involved in flexion of the hip and adduction of the flexion of the thigh and adduction of the thigh at the hip joint. The quadriceps then are primarily involved in extension of the knee joint. The rectus femoris is one of the quadricep muscles. It crosses the hip joint, so it is also involved in hip flexion. Okay, that's all I want to cover for this lecture. So please make sure that you review the content that we have covered here in your own time. Use the other resources that are available on Moodle as well to test your knowledge and help you revise. Thanks for your attention.